This is my first time Zooming as well as chairing in person, so bear with me. Welcome to the second meeting of the House of Commons Standing Committee on the Status of Women. Today's meeting is in a hybrid format pursuant to the House Order of September 23rd, 2020. The proceedings will be made available via the House of Commons website. And just so you're aware, the webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I'd like to outline a few rules. Members and witnesses may speak in the official language of their choice. Interpretation services are available, and at the bottom of your screen, you can choose floor, English, or French. For members participating in person, proceed as you usually would when the whole committee is meeting in person in a committee room. And keep in mind the directives from the Board of Internal Economy regarding mask and health protocols. Before speaking, please wait until I recognize you by name. And if you're on video conference, please click on the microphone icon when I recognize you to unmute yourself. For those in the room, your microphone will be controlled as normal by the Proceedings and Verification Officer. A reminder that all comments by members and witnesses should be addressed through the chair, and when you're not speaking, your mic should be on mute. The speaking list, the committee clerk and I will do the best we can to maintain order, and I think it's much better now that I'm in the room and I can actually see people. So to begin, let's start first with the committee business. You all received a copy of the subcommittee's report from last week.
Chair?
Yes.
Just a point of order, my staff is still in the waiting room. He's not been allowed in.
Oh, clerk, there's someone in the waiting room waiting to get into the meeting?
Yes, normally in a public meeting, the staff are asked to actually log into ParlView and to watch the proceedings on ParlView. That's the case with public meetings at this point. So Thomas is welcome to actually go onto ParlView and watch. There's a bit of a delay, or to use the phone lines.
Very good.
Okay.
All right. So for those of you that have had a chance to review the meeting of the steering committee, basically we approved all of the motions that were submitted. So we like all of those topics, and we consolidated the study on the impact of the pandemic on women and agreed that that would be the study that we would begin with. And so I think I need a motion to approve. Yeah. If the committee concurs with the recommendations in the report, then we will go ahead and commence our study. All in favor? Opposed?
I will.
Very good. I also have to ask for the committee's approval. We have a lot of witnesses that were submitted for the list. And if we don't make our way through those before the schedule to make the report by the end of the year, we will be requesting briefs from them. Is that agreed? Very good. All right, and so our first panel today is on long-term care, and our guests and our witnesses are Pat Armstrong, who's a professor with York University. We have Carol Estabrooks, who's a professor from the University of Alberta. And we have Jody Hall, who is the chair of the Canadian Association of Long-Term Care. Welcome to all of our witnesses. Each of you will have 5 minutes to give a summary, and then we will begin our round of questions with 6 minutes for each party. We'll start with Ms. Armstrong.
Thank you. I did remember to unmute. And thank you for inviting me here to talk about the long-term care labor force. Long-term care is primarily care for older women by women, many of whom are racialized and are immigrant. These facts help explain why so little attention has been paid to this sector and so little value is attached to this work. These are care places called homes, in part to indicate that people live there for a significant period of time and that their care needs are not exclusively medical. This too contributes to the limited attention paid to the sector and to the notion that, just like in the home, this is work any woman can do by virtue of being a woman. It's taken the high death rates in long-term care during the pandemic, combined with the military reports, to draw attention to both the conditions in long-term care and the skilled nature of the work. The military reports make it clear that the required skills are both medical and social, and that everyone working in these homes, including housekeepers, dietary, and laundry workers, needs specific skills to become part of the care team. Having tempted to food appropriately prepared, having knowledgeable assistance in eating, having infectious laundry efficiently handled, and being decently dressed can be just as important as ensuring that medicine is swallowed. The overwhelming majority of these paid workers are variously called personal support workers, care aides, or orderlies. There's no consistency in their formal training or in their access to continuing education necessary to keep up with the ever-increasing complexity of resident needs. Those who work as nurses, therapists, recreation directors, and physicians have more formal and consistent education, but often lack special training in long-term care. It's obvious we need to recognize, appropriately value, and educate for the specific skills required. It should be equally obvious that this is demanding work, too often carried out under poor working conditions. Compared to other industries, the labor force has the highest rates of absences due to illness and injuries, with back injuries particularly common. Work absences are just one indicator of the risk. Our research indicated that Canadian workers were almost 6 times as likely as those in Scandinavian countries to say they faced physical violence on a daily basis, even though residents' needs are similar. The major differences were staffing levels. According to the Canadian Institute for Health Information, Canada has fewer healthcare workers per resident than other OECD countries, quote, with a rate that is half as high as the rates in the Netherlands or Norway. Study after study demonstrates that an absolute minimum staffing is 4 worked hours of direct nursing care per resident per day, and no Canadian jurisdiction has such a requirement. Physical violent environments also create risks, with toilets jammed into corners making assistance hazardous, with carpets making pushing a wheelchair back injuring, and with malfunction lifts creating dangers for both residents and staff. The risks are also mental and social and are also linked to staffing. Going home feeling you could not provide the care your education has taught you to provide puts enormous stress on both the women and their families. Racism and sexual harassment are common. Death is a daily occurrence. It's frequently the death of someone they know well and grief they share with the families they also know well. These are just some of the excessive demands and the poor conditions pre-pandemic, conditions that the pandemic has worsened. And as we've said for a long time in our research, the conditions of work are the conditions of care. Unions provide some protection for workers' pays, benefits, sick leave, and job security, but unions have been less successful in their efforts to get minimum staffing levels, pay equity, more full-time employment, safe physical environments, and to prevent contracting out, often to non-union workers who move from place to place and fragment teams. The pandemic also draws attention to some ways workers' precarity creates risks for residents, as do some government strategies. BC recognized that those seeking full pay by working in multiple homes could carry infections with them, raising wages to attract and keep workers. Some even attended to sick leave, daycare, and transport. Quebec's offer to train and pay more for 10,000 additional care workers acknowledged the low staffing levels. But too many of these measures are temporary, which fail to recognize that secure employment in one workplace with benefits such as paid sick leave can help not only reduce infections, but also provide for the continuity of care and the support for teamwork that are so central to quality of work.
I'm sorry, Miss Armstrong, that's your 5 minutes. I'm sorry. I'm going to have to move along to Miss Esterbooks. You have 5 minutes as well, and when you get to have 1 minute left, I'll raise the finger, the good finger, and you may begin. Thank you.
All right, thank you very much for the invitation. Let me be very clear. The pandemic did not cause the problems in long-term care. Deep-seated attitudes about sexism and ageism did. The pandemic was just the proverbial straw on top of long-term, long-standing neglect. We have the highest death rate in long-term care homes as a percentage of national COVID deaths in the world. Over 80%, nearly double the hardest hit countries. This is both a national tragedy and an international shame. We failed older adults who need this specialized care. They have died in excess numbers, both from the virus itself and the conditions that it created. They have died alone, afraid, often in great suffering, and in the worst outbreaks of dehydration and starvation in their own excrement. Tragically, disadvantaged women have borne and continue to bear the brunt of the impact of COVID in long term care. The residents, the older adults there, are extremely vulnerable, half over 85, frail, with many coexisting conditions. About 80% of them have dementia, a progressive, life limiting neurological disease. In the Canadian population at large, over 2/3 of older adults with dementia are women. In nursing homes, over 2/3 of residents are women, usually women of lower economic means. The population of older adults in long-term care, however, is not a homogeneous group of old white people. The population there is increasingly heterogeneous, as is our general population. People with not only dementia, who are not only overwhelmingly female, but people with disabilities of various religious and ethnic backgrounds, with and without families, members of the LGBT community, and so on. Over 90% of all long-term staff in this workforce, as Pat has indicated, are women, with care aides, personal support workers being by far the majority. They provide 90% of hands-on, direct physical and emotional care. They are overwhelmingly female, 90 to 95%, unregulated, middle-aged and older. Half are immigrants in urban settings. The educational standards for this group are not standardized and vary from province to province and are the lowest of any required in the system. They are the most poorly remunerated workers in the system. As many as a third work more than one job pre-pandemic to make ends meet. And they work in homes that pre-pandemic were underfunded and high-stress environments and are now facing serious mental health challenges because of the pandemic. Anxiety, insomnia, depression, substance abuse, and in the most extreme cases, PTSD, which will persist for years. Our complacency and neglect and attitude toward the old and infirm and attitudes toward women and the work of caregiving, our belief that anybody can care for an old person with dementia got us precisely where we are today. That and our baffling belief that we could manage the system without data. The problems are solvable, but they are complex and wicked, tangled as they are with practical, readily solvable issues and much harder to solve deep-seated value issues. But if we do not solve them, this will assuredly happen again and again. We have thus far failed in our duty to care for our most vulnerable citizens, with particular savagery in some places in Canada, and it's incumbent upon us to do better. What needs to happen? We've got to first fix the worst of the workforce conditions. We must help women workers whose children are out of school and whose own parents may need care. We must treat families like families, not visitors. We must have data. For heaven's sakes, we need data. And what must not happen? Another commission inquiry and report, we can read the hundreds, literally hundreds that we have over the years, and they all point to the same solutions again and again. We must not favor acute over long-term care. We mustn't be unrealistic. This is not easy and it will take resources. And if we engage in endless acrimonious debate over federal versus provincial jurisdictional issues, we will not be able to progress. We cannot solve the immediate or longer term problems in Canada's care homes if we do not acknowledge and address the highly feminized environment of a home, a long-term care home, and what that means. If we do not value the work of caregiving, if we do not value lives that have been largely lived. Thank you.
Thank you. Now we'll go to Ms. Hall for 5 minutes.
Thank you, and I appreciate the invitation to be able to appear before you today to discuss the impact of COVID-19, the impact on women, and of course the long-term care homes right across the country. My name is Jody Hall, and I'm here today as the chair of the Canadian Association for Long-Term Care, also known as CalTech. We are the voice for quality long-term care in Canada, and our members deliver publicly funded healthcare services for seniors right across the country. So in addition to being here as a representative for CalTech, I did want to share that my roots have been in long-term care. And for me, I started in high school, where I worked in food services in a long-term care home. Eventually, became a member of the care team, and from there progressed to be an administrator of a long-term care home. And for the last several years, have served as the executive director of the Brunswick Association of Nursing Homes. And I share that, and that my perspective is very operational, and I hope that that is helpful for the committee's perspective today. There certainly are a number of areas of significant impact for women, as we have heard. This is a predominantly female workforce that we care for, and we commonly see issues related to childcare, and the many challenges around that, the provision of care outside of the homes to other vulnerable individuals like aging parents. And it does have a significant impact in the homes and our overall ability to manage. I do want to start kind of the rest of my testimony by acknowledging the seniors who have lost their lives as a result of COVID 19. And we certainly extend our sincere condolences to families who have experienced a loss in that way. And I'd also like to just pause and thank the frontline workers, again, many of whom are women, who continue to this day to provide very compassionate care to seniors that are in our homes across the country. So some of these challenges I'll be discussing have been exacerbated by COVID 19, but really they represent many systemic issues that our members have been raising for several years. We do believe that if government had been proactive in supporting the sector, that the impact of COVID 19 could have been mitigated. This is an incredibly painful time for everyone that's involved in long-term care, their families, the frontline staff, and we fully acknowledge that and hope that our efforts as a nation become far more focused on stabilizing the situation in long-term care as we now face the second wave of COVID. There have been differences in experiences with this virus between provinces and between individual homes, and that has been impacted by a range of factors, things like aging infrastructure, the staffing situation in the individual homes, how rapidly homes were able to access PPE early on, and a host of other things such as even access to infection control specialists. I'd like to focus the rest of my remarks today on the health and human resourcing needs. We are at a crisis point in Canada with respect to the supply of healthcare workers in the senior care sector, and this is the critical issue that will make a significant difference for seniors as we respond to COVID-19 going forward. Between 65 to 70% of the long-term care residents are women, many of whom have multiple complex and chronic conditions, including different forms of dementia. Attracting and retaining individuals who can provide this type and level of care that's needed has become increasingly challenging. Supporting healthcare aides, um, continuing care assistants, and personal support workers, again, most of whom are women, required structured education and continued training to support these individuals to provide the highest quality of care. It requires a structured governance model that to affirm the credentials, the contact, and the competency of these individuals. To harness this opportunity, the long-term care sector does require the support of the federal government that aims at solving the chronic labor shortage and aimed at supporting individuals to make the choice to have a career in long-term care. Additionally, specific to COVID-19, the federal government has a role that it can play in long-term care, which includes dedicated focus of funding for homes across the country. We have been calling for predictable and stable funding for long-term care homes across the country, and recently, with our budget submission, asked for $2.1 billion over 2 years that goes to support PPE, staffing, and other associated costs with COVID-19. to ensure the health and safety of residents and our workforce. We're also asking for additional supportive recruitment and retention for infection control experts. We
Thank you
believe
very
strongly.
much. I'm sorry, that's your five. We're going to start our first round of questioning, though, so people can follow up on your comments. We're going to begin with Ms. Wong, who is splitting her time with Ms. Shin. So, Alice, go ahead for 3 minutes.
Um, Good morning, everybody. And first of all, I'd like to thank all the who spent their valuable time and this very challenging time to share their experiences and also their views on a very important topic, and that is the impact of COVID on women. Um, I first of all like to say that I do also come from perspective of somebody who's visited many long-term care homes before COVID in a good number of years. And also even during COVID, I was able to deliver masks to staffers and to different seniors homes in the Lower Mainland. So I heard them and I saw them, and I definitely will, appreciate all the good work they've been doing, all the challenges as well. Now, COUT, I believe that Mr. Jody Hall, your association has written a letter to the Prime Minister stating that long-term care is included in any statement of share principles and that long-term care homes are top priority in share health system planning moving forward. That is something you wanted the Prime Minister to ensure. I just want to know whether you did receive any response from him. Ms. Hall.
Yes, a response was just recently received, kind of acknowledging the request, um, and basically creating an opportunity for us to have an exchange with the employees of the office going
Thank you.
forward.
And my next question is on the importance of the holistic approach, like what you've outlined in your letter. So how important it is it's not to look at one facet only, but holistically.
Yes, we completely agree with that, especially when we consider the needs of our workforce, again, predominantly female. Their needs often extend outside of the home itself as they continue to provide care to children and to aging parents and other vulnerable individuals. So, considering things like how do we support them in these areas is critically important.
Thank you. And caring for the carers, in other words, I mean, we don't only care for those who need care, but those who are giving care, like we call them carers in the British term. And we do need to care about them as well. And then also the families which have been affected, definitely. So thank you for restating that. Now, about federal money. So I know that you also have specific concerns regarding federal dollars being invested on the long-term care to help seniors. Uh, and do you think that the federal government has already committed to increase funding?
Well, certainly we acknowledge the assistance that's been given with the Safe Restart money. That hasn't always translated, or it's translated differently in each province, if I can express it that way. Not every province has received, or the homes in each province have not all necessarily received the funding that was given. And so we're still working towards achieving that. But we are looking forward, forecasting for the next few years and see that the needs are much greater. And although we appreciate the Safe Restart money as a start, we know that much more support is needed as we continue to face, in particular, COVID-19, but also these systemic challenges that existed long before we were faced with the pandemic.
Very good. And now we'll go to Ms. Sahota, I think, for
Thank
the
you.
other 3 minutes. Thank you.
Good morning, everyone. Thank you for your time, for being here, and for everything that you guys are doing. So I have a question for Ms. Hall. On your website, it says organization has listed several priorities, one of them being three critical areas where federal policy changes and investments will make the largest impact on the quality of life for seniors living in long-term care, that being health and human resources, infrastructure, and digital solutions. Could you please expand on those?
Madam Speaker, we can't hear,
You're
Madam
on-
Chair, we can't hear the witness.
I'm
You're on
sorry,
mute.
okay, I've unmuted. My apologies.
And Madam Chair, could the witness put the microphone closer to her lips because she's difficult hearing. Thanks, Ms. Hall.
Okay, hopefully that's helpful to hear a little better. My apologies for that. In regards to health human resources, we are calling on the federal government for support in the development of a pan-Canadian health human resources strategy. This is an area that is the uh, most consistent top level issue for long-term care right across the country. We are facing a crisis as it comes to available staffing, and I have noted several different types of examples, further support for immigration, but also enhanced efforts in regards to education and promotion of careers within long-term care. And so those are areas that we have immediately identified as needing or that could potentially offer support. Um, for infrastructure, we have been noting this as a critical issue with aging infrastructure in many jurisdictions across the country. And, we saw kind of the full impact of that as it relates to COVID-19 and the spread of that virus. It was incredibly challenging for some homes that have very narrow hallways, small rooms, um, making it kind of shared dining areas that made it incredibly difficult for the infection control practices to be fully implemented in the way that we knew that public health intended. And so there is an incredible need for that to be addressed going forward. On the side of data, it's very challenging to compare long-term care across the country because of the void of data that we have. There are many homes across the country that are using an InterRI resident assessment instrument, which the data is submitted to the Canadian Institute for Health Information, and that does allow for some comparable information. But we're also advocating for the addition of a management information system, which allows for more of the business type of information, sort of the administration, the spend, the impact, where the money is going, and for us to be able to track that. We acknowledge that with the ask that we are making of the federal government being able to adequately report on the impact of those investments and to better understand the care needs of residents and where investments need to go is critical. And so we would ask for that added support.
I'll have to go now to Miss Sidhu, and I'll give everybody enough extra time to make up for the long answer. Thank you.
Thank you, Madam Chair. Good morning, everyone. I would like to begin by thanking the witnesses for their testimony. I would also like to thank my colleagues across all parties for working together and agreeing to continue to study COVID-19, how it impacts on women. It is good that we are beginning by looking at how COVID-19 has impacted women in long-term care. As we all know, just how hard hit long-term care homes across Canada have been by this virus. So my question is to Professor Armstrong. In my regional field, we have had over 962 total cases and 200 deaths among staff and residents in long-term care due to COVID-19. This is without a doubt a tragedy. And I have been working along with my colleagues to advocate for a national standard in our long-term care homes. Even though long-term care homes comes under parental jurisdictions, we all know. I know between 25 and 2019, our government increased the funding, long-term care funding, to over 500 organizations, and Senior Horizons focused on the seniors program as well. But there's a lot more need to do. And Professor Armstrong, you talked about a lack of special training, special skills, and health specialized care. So, what unique consideration should they give to women who live in these long-term care homes? We all know we need more staff. There's a shortage of staff as well. Can you elaborate on that?
Thank you very much for the question. Uh, there have been studies going on from the World Health Organization, from the OECD, the ILO. Just a year ago, we were warned we were going to face a terrible crisis in recruiting and retention in long-term care unless we did something about the entire range of working conditions, including, and this relates specifically to what you were saying, a recognition of the skills involved in this work and the valuing of the labor force. I interviewed a resource director in Norway who said what surprised her most when she went to long-term care was how demanding the work is and how hard people work. And that's been made invisible, I think, including all of the extra work that they do without pay in long-term care. So we have to have minimum staffing. We have to have decent wages. We have to have as much full-time employment as possible and permanent part-time to fill the rest on the casual. We have to have people work in one place, as BC showed us. We have to recruit more people, and we have to make sure that they have training that recognized, as Carol said, um, what is required in this job. And the work is medical, and it's also social. And it involves the full range of people who work in a long-term care home. So we need all of those things at once. It's been laid out for us again and again and again, as the recent Ontario Long-Term Care Commission said, and Carol also repeated this, we don't need more studies, we need action. And I think we need federal action paralleling the Canada Health Act that says you meet these conditions and we'll give you money, but you have to prove you meet these conditions, the standards the throne speech talked about.
I know women are also much more likely than men to provide unpaid care to family and friends who live in facilities. How can provincial government address this gap in compensating the unpaid work that women who work in these homes and family members do to support residents in long-term care? What role could the federal government play in this? You said the federal government to play the role, but what role could the federal government play? And also elaborate to the how can provincial government address this gap?
I think that thank you again for that question. There are two kinds of unpaid care. I didn't get to that in my talk. One of them is the unpaid care by the people otherwise paid for the work. They do a lot of it. They work through lunch. They take home people's clothes to watch. They do shopping for them. They do all kinds of things. And that's the women who do the work, who do that. And of course, most of the people that Carol talked about who come in as family is usually a term we mean really for women. How can we support them? First of all, we can support them by making sure that there are enough staff there to do the necessary work. That's why they do all this unpaid work, is that otherwise it doesn't get done. So that's the first thing we have to do. Secondly, I think we have to provide the kind of training and protections for those family members who do that unpaid work and want to do that unpaid work and do it as an option. And I think the federal government could make sure by sending decent staffing levels and training and infection control, they could help all those doing unpaid work.
Uh, Thank you. My next question is to Ms. Esbrook. I know some provinces have emphasized policies around aging in place or aging at home for seniors. I wonder if you could explain what impact this has on residents who are in long-term care homes today, especially on female residents. Has this resulted in increased chronic diseases such as diabetes? Can you explain that?
Thank you for the question. One of the primary effects of successful aging in place programs, and here in Alberta, we've had as early as 2006 to 8, we put a very aggressive aging in place set of policies in to keep people in the home. or at least in the community or in alternative living, to keep people out of long-term care as long as possible. And that's been quite successful. One of the challenges, or unintended, not really unintended, but challenges of that is it's meant that the people, the women primarily who go to long-term care, to a nursing home, they go very much later in the trajectory of their life and of their dementia and of their other chronic conditions. So it's not that it's increased the chronic uh, conditions themselves, but as you get older and closer to death, within the last year or two of life, if you have advancing dementia in particular, you become much more acute's not the right word in long-term care, but your needs are more demanding. You're a heavier workload, and they're more complex. And they're not just complex medically, like managing symptoms, which we don't always do very well in long-term care. Um, there are now data longitudinally that show us that there are unacceptable levels of symptom burden in the last year of life in many places. But the social needs are more complex because as your dementia gets to those stages, you have difficulty communicating. And so things like a pandemic where you're isolated are catastrophic for the person with dementia, both in the community, but especially in the nursing home. And even if you have staff coming in, they're dressed in masks and clothing so that they can't hear well and they can't see their faces and they're afraid. So these people that we see in many jurisdictions.
I'm sorry to cut you off, but that's the amount of time that you have, Ms. Sidhu. We'll continue on. We'll go to Madame LaRouche.
Merci beaucoup. Merci également témoins.
Thank you very much. Thank you to the witnesses for appearing before the committee today. You'll understand that I am the critic for the status of women, but also for seniors. So what I'm hearing today is very touching. I know that senior women, have very much suffered during the pandemic and have suffered many impacts. Now, I'm going to be very clear from the beginning. We are talking a lot these days about national standards. You'll understand that health really falls under Quebec and provincial jurisdiction. That's very important. And that's something that we hear from Quebec and the provinces. They've asked that this jurisdiction be respected. The problem is more on the financial side. There's not enough money to properly pay people, personal care workers, for example. And we've also talked today about the lack of workers, for example. There's been also guardian angels, migration, people's status. Sometimes it was PPE that was missing. And that's another issue that the federal government could have helped with, but it's clear that there's a problem with funding. So I'd like to hear whoever wishes to answer what it will take to properly fund the system so that we can then think about properly paying the people who work with our seniors and so that we can buy the proper equipment to protect people.
Well, I can start if that's acceptable. There is, in terms of federal provincial jurisdiction, there's absolutely a need for additional resources, particularly around the workforce. But to think that we ought to transfer substantial resources without ensuring that across the country we have some reasonable, at least minimum standards around education and care hours and care quality and the quality of life of residents seems perhaps to fall short of what we ought to be doing. What many of us believe we need to do is have a federal, provincial, territorial cooperative effort that doesn't trample on people's jurisdictional rights, but neither falls short of demanding that certain standards be met before transfers are made. So I'll open with that and see what the others have to say.
I would, could I speak next? Is that all right? Thank you very much. I wanted to say two things. One is that how much we spend, which I understood to be part of the question, is a matter of values, as the Romanoke report made clear. And we haven't sufficiently valued this labor force or those people who need this care. So it's time we did value them, I think, and that the federal government has an important role to play. And as Carol said, shouldn't just give away the money because it doesn't necessarily go there. The other thing that I think it's really important to remember, and I was coming to this, is that there is a care economy, and putting money into this sector would be an economic stimulus. The money doesn't go into a pit somewhere. It goes to people who then spend the money. And if we're talking about infrastructure and stimulating the economy, the care economy, as the UK Women's Budget Group makes clear, is a very sensible way to go.
Hi, and if this is Jody, if I can just add, I completely agree when it comes to the jurisdictional question between the federal and provincial government. For us, this has become a time where we need to look at this as a shared responsibility. I think the transition of the age of our population across Canada is can't be borne by the provinces alone, and so that is for us a critical um, consideration for how the provinces and provincial governments work together, or federal government, sorry. For standards and national standards, we absolutely will work with the federal government. As I noted before, we strongly support the implementation of the use of data to be able to understand what standards are needed and how they can be looked at in different jurisdictions. We do have a very specific financial ask that we've put forward as part of our federal budget submission, which is $2.1 billion, specifically targeting needs around COVID over the next 2 years, which is what we believe is required to stabilize the situation in long-term care. That's for immediate repairs and infrastructure. It's for staffing and looking at issues around wages and recruitment incentivization, and of course purchasing PPE. But beyond that, there absolutely is a discussion that's required to address these long-standing systemic challenges that we know is required for the future of long-term care.
Merci beaucoup, mais je pense.
Thank you. But in regards to money, Quebec and the provinces is asking funding to be increased because it has been cut by 10 billion almost. So it should be increased by 35%. It was already increased by 50% in health transfers, and Quebec and the provinces need the money to reinvest with their seniors. I'd like to hear as well, because we're talking about how money like this could help fund at-home services and to keep people at home longer. Ms. Armstrong, I'd like to hear you on the question of invisible work, to recognize the work of caregivers. You were talking about how people will be able to either have better wages or have refundable tax credits, but to recognize especially the importance of that invisible work in order to develop better policies, in order to encourage people who do that work and everything they do to help our seniors in their homes.
I think that our strategy has to begin by recognizing the difficulties of doing that work. We have a current project that is actually looking at the move into long-term care, and we have interviewed so many women who have reached a breaking point in terms of trying to provide care for someone at home. Certainly, we need more care. Certainly, we need to have better physical environments. We need to have what many people are talking about in terms of the 15-minute neighborhood. We have to think big, I think, in terms of the notion of home care, and we have to understand that staying at home is good for many people, but many people don't have a home. Many people have a home, especially women, a home that is abusive, physically, mentally, socially. So while we need to support care at home, we also need to understand the intensive labor that goes into it. And we have to provide alternatives for that as well as supports for that, which I think is the case in terms of long-term care. So there's certainly home care, but we also have to think of what that requires in terms of the
Very good.
extensive labor done by women.
And that's your time. We'll go now to Miss Matheson.
Thank you, Madam Chair, and I thank all the witnesses for sharing their expertise with us today. I think that one of the key problems that I see as stemming from this, and Ms. Armstrong, you had talked about this, I think all the witnesses did, is that value of people. And so when we talk about one of the major problems within long-term care, it's the fact that it is majorly for profit. And when we saw the expiration of medications, we see lack of adequate staffing, and those staff not being provided the proper PPE because it costs too much, so on and so forth. I mean, ultimately, we're talking about that profit at the center of it. So one of the things that we proposed is ultimately that long-term care be pulled into the Canada Health Act, that profit side be taken out of that, and you tie funding to strong national standards, ensuring that those national standards, of course, mean something when you actually provide staff with the time they need to provide that high level of care. So I'm wondering if you could speak to, I know, Ms. Armstrong, you had talked about the right to care, and linking that with something as strong as the Canada Health Act, that no matter how much money you have, no matter where you are, you have that right to care. But all the witnesses, I'm sure, we're talking about that.
Well, I agree that the public money should be going to care that is not to profit. But I think we should also be clear that there's nothing in the Canada Health Act that prohibits for-profit delivery. It only requires public administration by a not-for-profit agency. So if we're looking to the Canada Health Act for protection against public money going to profit, then that's not the place to go, I don't think. I do think that our strategy ought to be raising the standard and making sure that those standards are met and enforced and based on verified data. We've talked a lot about data, but those data have to be verified. We have to make sure, and this came out in the report from the seniors advocate in BC, that there's very strong emphasis on verified data, because she argued convincingly, I think, that the data, especially around staffing, for instance, was not verified. And I think that we should be raising the standards to an extent that there isn't room for profit. Now, one other thing I'd say, it's a pattern. Not all for-profits are terrible. Not all municipal homes are wonderful. We're talking about patterns, as we always are, in any health services or any social services.
Are there others? Okay. So in addition to that, in terms of that value of people, it comes down to the workers and the respective workers, and we've heard a lot from those in early childhood education, and the idea that care and that role of care is done by women, but not valued because it's majority women, and that gendered aspect doesn't provide them with the respect, with the professionalism that ultimately those professions do require. So I'd like to hear a little bit about that, but also there was a mention of ILO conventions, and I believe that there was an ILO convention on unpaid, the recognition of unpaid work. I think it's been out there for about 10 years now, and what the passage of that by the Canadian government could help, how that could help.
Well, I think if I should go ahead, although Carol had her hand up, I think that the passage could help, but like other legislation, it can only help if we have an implementation strategy. And we have a lot of legislation on the human right to care, for instance, that we've adopted but haven't really done anything about. So if we're going to adopt it, I think it has to come with a series of strategies to not just recognize it, just like we shouldn't, healthcare workers don't want to be heroes. They want to have decent pay and decent supports rather than just being called heroes. We have to do more about unpaid care than call them heroes and wonderful, loving people, because a labor of love is still labor and it still requires supports.
I think Ms. Hall wants to speak next. Thanks.
Thank you. I just wanted to make an additional comment in regards to the question regarding for-profit in care. I did want to simply highlight that there are significant provincial standards and budgets that are set, and funding that goes to all homes, including private organizations, is received in protected envelopes. So things like staffing and food and care supplies, items of that nature, if the money is not fully spent, it does have to be returned to the provincial government. And so that is something that is overseen at the provincial level. COVID certainly affected all types of care homes, municipal, public, and private. And the impact of that was not exclusive to any one type of organizational model.
And final comment from Ms. Esterbrooks.
Yes, I wanted to go back to the issue of respect that was mentioned. If we think back to George Orwell, we know or we believe that if we take a word out of the language, the concept ceases to exist. In Canada, we don't even count personal support workers and care aides accurately. We don't track their wages easily or accurately. We don't assess the quality of work life that they have routinely. They're not paid very well. They're not educated very well. In English-speaking provinces, half of them in urban centers don't speak English as a first language, and the testing for whether that's sufficient to give care is variable across the country. So those are just symptoms of how we don't respect and regard this workforce, who are looking after a population that we don't respect and regard very much. And we have to think of nursing homes as places that are driven by dementia care. Dementia is on the rise. We're getting older, and it's not going to slow down. There will very likely, always be a smaller population of people with dementia. We're going to need nursing care. And if you need it in a nursing home, it's the right place to be if the care is acceptable. Recently, a survey in the U.S. reported that half of the people surveyed said they'd rather die than go to a nursing home. That's just not okay. We have a high income country, so we need to really. And these are all issues of values. I can't think of an existential fear greater than dying alone, but that's exactly what happened during COVID, and it's still happening for these older, often women. So I think we need to step back and say, how do those values influence us? When we say we have to have data, and we all say we have to have it, we don't need just quality care data or data on wages. What we need data about how this workforce is managing. Are they resilient? Are they able to manage the clientele they have? Do they have the right education? Do they ever get continuing education? Do they get childcare? What about their aging parents at home? And in the matter of unpaid family caregivers, we have relied disproportionately on family to carry the burden of what we don't want to pay for as a country. By 2050, there'll be a third less family caregivers, who are largely women. And that'll come.
I'm really sorry. That's the end of our time. I really apologize. I wish I could listen to our witnesses all day. You have so much information to share, but I'd invite any other comments that you want to make, you can send to the clerk. And I want to thank you for your time. We're going to suspend the meeting for 2 minutes to do a sound check on our next panel. So we'll do that now, and we'll be back in 2. dignity and support for sex workers. And we have with us as witnesses Julie Bauman, who's the co-founder and executive director for Safe Space London. We have Jenny Duffy, who is the board chair for Maggie's Toronto. And we have Julia Drydick, who's executive director for the Canadian Centre to End Human Trafficking. And I understand that Julie Bauman and Jenny Duffy are going to share their time. So I'll leave you to share your 10 minutes and I'll put one finger up when you get 1 minute away from the end. And then we'll have Julia after that. So Jenny and Julie, go ahead.
Hello? Can you hear me? Oh.
Yes, we can.
Okay, sorry. Hi, my name is Julie Bauman. Sorry. Hi, my name is Julie Bauman, and I'm the Executive Director of Safe Space London. I'm joined by my colleague, Jenny Duffy, who's the board chair of Maggie's Sex Workers Action Project. Thank you for the invitation to speak with you today. Safe Space London is our city's only organization centering the needs of sex workers, guided for the past 11 years by our mission to nurture a community of mutual care by, with, and for sex workers.
Maggie's is Canada's oldest by and for sex worker rights organization, which exists to provide community support services and advocates for the dignity and safety of sex workers. For the sake of clarity, it is important to emphasize at the outset that as organizations with and of sex workers, Safe Space London and Maggie's honors and supports the strengths, wisdom, experiences, freedom, and agency of sex workers who choose to engage in sex work and who wish to work in a safe and dignified work environment, just like workers of any other profession, while also opposing any kind of exploited or coerced labor for sexual purposes. On the ground, Safe Space London offers a safe and secure community drop-in space for women and gender minorities who either currently or formerly have engaged in sex work. They offer companionship, the sharing of wisdom, clothing, food, information about bad dates, access to the internet, harm reduction related equipment, and linkage to other services.
All of this changed dramatically as soon as the COVID-19 pandemic hit in the spring of 2020. While social distancing can be an inconvenience to those who are more comfortably situated within our communities, for those who are isolated, abandoned, and otherwise left for dead by both governmental bodies and social services, this kind of enforced distancing can be absolutely death dealing. During the pandemic, everyone suffers in some way, but the most vulnerable, to say that, the most oppressed, suffer in ways that are unbearable, humiliating, and extremely painful. As one woman who came to our space early on the pandemic said to one of our coordinators with tears in her eyes, "You are my last hug." First off, overnight, Safe Space, we were no longer able to host community members within our small space, and instead we were only able to offer a very brief, socially distanced peer contact with community members outside of our space in the parking lot with no privacy or shelter from weather.
Prior to COVID-19, Maggie's provided street outreach and in-person programming, which included community meals, drop-in legal services, support groups, and Indigenous-specific programming. Due to the pandemic, we have been challenged to shift our programs online. However, many of our service users lack access to stable internet connections, and as a result, our Indigenous programming in particular has seen a significant drop in participation. Secondly, the inability of community members to access previously open public spaces has meant that now many lack access to any kind of washroom. With limited options, public washrooms are vital spaces for individuals in our community to have a place to wash their hair and body in the sink, to change, rest while working, to use a toilet. COVID closures left no space for these needs.
It took us several weeks of sustained advocacy on behalf of our community members before the City of London finally installed a porta potty by our address. However, porta potties, as we all know, are not exactly as safe, clean, or private. The city chose this simply because it was the cheapest, which again demonstrates the ways in which people actually view those classified as priority populations. Our ability to continue to rent at our location, which we chose not only due to its cost, but of where it is in relation to sex work that occurs in our city, is now in jeopardy because of the backlash to the porta potty.
Thirdly, at Maggie's, where many of our service users struggled already to meet their material needs, the pandemic and the exclusion from the Canadian Emergency Response Benefit put them at even further disadvantage. Due to the lack of government response, we took aid into our own hands and established a mutual aid fund, which received donations totaling over $100,000, which we dispersed to sex workers across the industry who are now struggling to provide for their very basic needs. While Maggie's has received international praise for establishing one of the biggest mutual aid funds in North America, we continually remind the public that we should have never needed to do this. The creation of a mutual aid fund was the last resort to the government failing vulnerable communities, despite already having heard from countless advocacy groups, including sex workers themselves, receiving thousands of pages of empirical evidence across social service and legal fields that decriminalization is the first step to an equitable existence for sex workers, and that sex workers are laborers who are entitled to access government support and labor protections, just as any other worker. Lastly, but perhaps most importantly, when the COVID-19 pandemic first hit, numerous other community services raised barriers, began to serve less people, meal programs closed, shelters were over capacity, and many organizations stopped taking new referrals. Almost all community services moved from in-person to virtual or telephone conversations with clients. We saw an explosion of need in our community. In the sex work community, there is so much newly created job insecurity. Our community is being further stigmatized due to the government's handling of the pandemic and without evidence ordered the closing of safer spaces to work, such as adult entertainment facilities.
A lot of people ended up with nowhere to go for food, nowhere to go for diapers for their babies. A lot of people ended up feeling lonely, stigmatized, with nowhere to go for support or companionship. We recognized the great need in the London community, and we committed ourselves as best as we could to pushing onward, because we chose to expand our supports to others oppressed, impoverished, criminalized, dispossessed people. We did receive some emergency funding grants that have supported us to attain PPE and proper sanitization. And we have received some additional support in providing hot meals and other basic needs items. As a result, the number of people coming to us for assistance has increased dramatically. We do this despite what it costs us, because we feel that nobody, regardless of who they are, regardless of our particular area of focus, should be abandoned and left to die. And indeed, it costs us. We've literally pooled our own money together to house people when they were turned away from full shelters and couldn't access other organizations who held the funds to hotel rooms. It costs us as individuals, as we are trying to meet a far greater need, who are volunteering longer hours without any compensation, all while many of our own jobs are being legislated against, and many of our own bodies being treated as high risk or dangerous to the public. Our hours have been expanded from being open 3 days a week and serving 80 unique individuals before COVID to now being open 5 days a week. We went from serving no hot meals pre-COVID, as this was not a core mission of our service delivery, to now serving hot meals 6 days a week with 200 unique individuals. It costs us because we are people who care. We are doing everything we possibly can just to help anyone and everyone survive. We are still working through the repercussions of these costs.
Being sidelined while being told you're a priority population is expensive. It costs us. Thank you very much.
Very good. Now we will go to Ms. Strydick.
Hello, can everyone hear me? That's great. So I would like to thank members of the committee for having me here today. My name is Julia Drydick, and I'm the Executive Director of the Canadian Centre to End Human Trafficking. The Centre is a national charity dedicated to ending all forms of human trafficking in Canada. We work to mobilize systems change by collaborating and working with various stakeholders to advance best practices, share research, and eliminate duplicate efforts across Canada. In May of 2019, the Centre launched the Canadian Human Trafficking Hotline, a confidential multilingual service that operates 24/7 to connect victims and survivors with social services and/or law enforcement if they so choose. One of the questions that we get asked the most is whether or not we have seen an increase or decrease in calls to the hotline since COVID-19. What I can say definitively is that human trafficking has not decreased in any capacity since the pandemic. While there are ebbs and flows in the volume of calls that we receive, overall, the demand for our service has been stable over the last 6 months. On the other hand, we have no quantitative evidence to suggest that there's been a significant increase in the prevalence of human trafficking since the pandemic started. Again, our average weekly and monthly call volumes are pretty consistent with what we were experiencing prior to COVID. And while we have seen a slight increase in call volumes, this could be due to a number of other factors, such as it being our first year of operation, or ongoing improvements and adjustments to our outreach and communication strategies, meaning that we're doing a bit of a better job in targeting those people that would benefit directly from our services. So I want to take a moment to talk a little bit about the impact that the pandemic has had on our ability to do our work and serve victims and survivors of human trafficking across Canada. Like many nonprofit organizations across the country, we had to adapt really quickly to the COVID-19 pandemic. As soon as the lockdowns began, we had to find a way to transition to remote operations. And while this has been a learning curve for everyone at the center, we're very fortunate to be working safely from home, and we've been functioning at full capacity in operations since April. However, many of our frontline service delivery partners experienced far greater challenges in providing services. As soon as the lockdowns began, we issued a survey to 755 of our service delivery partners across Canada, coupled with extensive follow-up and online research to update our national referral directory. And the results of that work were quite shocking to us. In April and May of 2020, roughly 1 in every 5, or 22% of the total number of individual services and programs available to our hotline callers were not being offered at all, or they weren't accepting new referrals because of the pandemic. In addition, 71% of programs and services in our national referral directory were still accepting referrals, but they'd implemented changes to how they were providing services. So things like reduced or modified hours of service, remote or digital services only, the prioritization of crisis over non-urgent referrals, and of course, the introduction of health and safety guidelines for shelters and residential programs. All of these protocols created additional barriers for victims and survivors looking to access services. For example, we heard that some survivors struggled to maintain emergency housing services, as many really struggled to comply with the COVID precautions. An example of this is a survivor leaves a shelter to visit friends or family or try to access a food bank, and they may not be allowed back because of the risk of exposing other shelter residents to COVID-19. Some survivors have also mentioned that the physical restrictions that have been placed on them during quarantine reminded them of their trafficking situation, which can be both triggering and re-traumatizing. Shelters have also been reaching capacity more quickly due to the requirements of physical distancing, and this is decreasing the overall number of beds available to human trafficking survivors. And some survivors lost access to needed services and supports altogether, like drop-in programs and counseling services. Survivors simply have had fewer supports available to them because of COVID. In conclusion, I want to emphasize that sex trafficking survivors are often placed on a continuum of sexual and gender-based exploitation, and I really do applaud the work of this committee for including this issue as part of its broader research agenda. I'd also encourage the committee to consider what the impacts might be for women that are experiencing sex and labor trafficking. There are gender dimensions of labor trafficking as well, especially in home care, garment, and manufacturing sectors that require additional research. We're currently working on how to improve engaging with those communities, as they can be traditionally hard to reach. But anecdotal evidence from the field suggests that we're only scratching the surface in understanding the depth and breadth of labor trafficking in Canada. So thank you very much again for the invitation, and I'm happy to answer any questions I can.
Excellent. And now we're going into our first round of questioning. Everyone will have 6 minutes. I apologize to the witnesses in advance. I will cut you off when I get to 6 minutes so that everyone gets a chance to ask their questions. We'll start with Ms. Sahota, who's splitting her time with Ms. Shin. Ms. Shin is starting.
Yes.
Thank you so much. I just want to thank everyone, all the guests today, for the incredible work that you do to give women dignity. This is a very sensitive area, and a topic that really is rooted in the concept of slavery and demoralization of women on so many levels. And I thank you, applaud you for approaching these with compassion. So thank you, especially during this very difficult time with COVID and the complications caused by that. I would like to direct this to Ms. Drydick. Globally, the United Nations has reported that COVID-19 has driven human trafficking further underground and made it more difficult to identify cases of human trafficking and has strained the capacity of enforcement agencies and non-governmental organizations that provide services to victims of the crime. In what ways has the COVID-19 pandemic driven human trafficking further underground? And could you elaborate on the ways in which the COVID-19 pandemic is affecting the capacity of enforcement agencies and non-governmental organizations to provide services to victims and survivors of human trafficking?
Absolutely. Thank you for the question. And I also just want to start off by saying that as an organization, we're very clear to differentiate between consensual sex work and human trafficking. However, what we see in Canada is that there is human trafficking that exists within the commercial sex market. So we're very clear on that front. One of the major trends that we see in terms of where and how human trafficking is taking place in Canada is largely through hotels, motels, Airbnbs, and the online escort industry. And there, I have to say, based on what we've been monitoring, there are no evidence-based trends to validate the claim that we're seeing the same push into the underground market. Folks that might be working closer and more on the ground, also with consensual sex workers, might understand some of the impacts that that has had. But largely, we're still seeing that this is operating in that space of online escort services.
For that, just on the note of this happening in hotels and motels and online escort services, what is a way that hotels and these different forums that this is taking place, how could they cooperate more? And what does the cooperation look like?
The hotels have been quite strong in terms of starting preliminary training with many of their staff. We would like to see training across the board, but they have made good inroads. Where we're seeing a major gap is in Airbnb. Those spaces also because often the people renting the premises will never see the people renting them. So there aren't those kind of checks and balances to be able to pick up on the signs of exploitation. And one of the things that we do very much as a hotline is to provide that immediate education and support for people that are seeing something that doesn't seem right, to really help them differentiate between whether or not there's indicators of human trafficking versus consensual sex work. And so often we will get people from hotels and from the service industry calling, suggesting that they're seeing something that seems suspicious. And really, we look for those indicators again of comprehensive exploitation. So individuals that aren't able to speak for themselves, that are not talking for themselves, where their ID or other pieces of money might be taken away from them, or where there's signs that they're being physically controlled.
Very good. Now we'll go to Ms. Sahota.
Just want to start off by thanking all the witnesses for your testimony and for your time. I will be asking questions to Ms. Julia Drydick. Did I say your name right?
Drydick, yes.
Drydick, okay. I'll just call you Julia if that's okay.
That is completely fine, thank you.
Julia, you said that in your testimony, you said you haven't seen the volume of calls increased in the last 6 months. Well, we've been in pandemic for longer than that. I'm just wondering, did you see an increase in the beginning of the pandemic?
No, and I will be honest too in that we had to suspend operations for about 2 weeks at the beginning of the lockdowns because it simply we weren't able to create a safe space for our colleagues. And actually, through our funding agreement with public safety at that time, we were prohibited from working remotely because of the sensitivity of our data. So we suspended operations entirely for 2 weeks, and then we're able to start up partial operations until we were able to go completely 24/7 again. So there we saw some disruptions in our services, but also it took a little while to be able to get back to our normal volume. There has been an increase controlling for that period of time where we weren't operating at full capacity. We've seen about a 20% increase in signal volume since COVID has taken place. And again, that's not insignificant, but we can't specifically attribute it to one part of COVID. We don't know if it's because there's additional exploitation taking place for people that might have been really poorly affected socioeconomically because of COVID. We have no direct insight in terms of how it might have affected the sex market generally as well. And so because we really meet people where they are and we just focus entirely on providing them those services that they need in that moment, we just have not been seeing those same forms of trends.
Very good. Now we'll go to Miss Dillon for 6 minutes.
Good afternoon. Thank you to all the witnesses for being here and testifying about these very serious and disturbing parts of our society, I guess we can say, especially the vulnerable state that the victims of trafficking are in. My first question is for the Canadian Human Trafficking Hotline, Ms. Drydeck. You spoke at length about how operations had to be shut down due to the pandemic. All of a sudden, there was a lack of services being given to the victims of sex trafficking. My question to you is, what are your recommendations? How do you think we can prepare better for a future pandemic or another state of emergency? The best practices that you found that would be beneficial to other organizations through your own, the experiences of your own organization, and to help the victims as well at the same time. So, if you could please tell us how we can prepare for a future pandemic or if there's ever a national state of emergency or anything like that, that such victims, such vulnerable people don't get left aside and become even more vulnerable than they already are. Thank you.
Yes, thank you very much for the question. I think one of the challenges that we've seen since the pandemic is that the very baseline that we were working off of in terms of access to emergency and shelter services based on individualized needs, when you look at the general state of the social safety net in Canada and these programs specifically for people that are generally oppressed, stigmatized, and marginalized, we weren't working from a great space to start off with. Part of what I think people need to consider is the fact that human trafficking services um, should not be considered in complete isolation to other services associated with homelessness and housing and other supports for women experiencing other forms of intimate partner violence and gender-based violence. We don't necessarily always need to have a human trafficking specific system, but when that overall system is struggling, where it's hard to place anyone in those systems, then those who have gone through the traumas and have other kind of specific needs associated with having a trafficking experience, it means that it's just that much harder to be able to find a place for them. One of the trends that we're seeing in terms of requests for services is that, especially because of the trauma, but also when people initially exit human trafficking, being in a very highly regulated emergency shelter system does not work for them. The hours of when they're expected to wake up and go to sleep, and then again being controlled in terms of what they're eating, when, and how. Also, because often people will use substances to try and deal with the traumas experienced. So I think because we've got a general lack of harm reduction, trauma informed housing and wraparound services in Canada, adding a pandemic to that only makes it worse. If we're really going to get at the heart of this, it means that we're going to take a coordinated, evidence-based approach to really mapping out these services across the country and making sure that in every area across Canada, we've got the services in place to meet them when they need support.
And as you know, our government, since the beginning of the pandemic, has given a lot of funding to women's organizations and women's shelters. And we are trying to keep up with the demand. And it's a day by day thing based on a day by day request for more services, more funding. So I wanted to know, how can our government directly help your organization and organizations such as yours for the phenomenal work you are doing to help those who are most vulnerable in our society? What can we do more to help you to be a bigger source of support and help you keep doing your work? Thank you.
Thank you. And I do want to recognize all members of the committee, but also all levels of government, including the current governing party, but also everyone else in their commitment to this issue. I think it's so important that it remain a nonpartisan issue, and that support is so important in actually, moving the bar in addressing this issue. We have a great relationship right now with the federal government, and I think part of it is also being willing to look at those jurisdictional boundaries. So specifically in the most updated federal anti-human trafficking plan, they added the element of empowerment, where we're actually seeing the federal government invest directly in social programs, which normally are not under the purview of the federal government. So I think being able to really look at where there are gaps and come together and collaborate and work together to address those gaps in a long-term and sustainable way, that is fantastic. And similarly, in depoliticizing the issue and making sure that everyone is on board and making sure that there's, ongoing and sustainable funding for these organizations doing this work. We're still learning a lot around best practices, but we also need to be able to have enough funding and resources so people can conduct proper evaluations, they can learn from their successes, and that they're not constantly worrying about, the administration of potentially running out of funding based on short project timelines.
All right, and now we'll go to Madame LaRouche pour 6 minutes.
Merci beaucoup.
Thank you very much for what you've told us. It really sheds a light on very problematic situations, the link between sexual exploitation and the pandemic. I'm also part of the multi-party group against modern slavery, and there's a bill that will be brought forward in the Senate to deal with this issue. So I imagine that you will be able to take a look at it as well. We're talking a lot about sex work, but we know that exploitation and modern slavery goes much beyond that. So I'd like to come back to this issue. Well, we've seen this. There are two schools of thought. Some say that no matter what women do, they need to be able to decide what to do with their bodies, but they can still always be victims of sexual exploitation and of that industry. Those are two different ways of thinking, but there's also the issue beyond that. How to say this? How should I put this? There are also women who are entrepreneurs who've engaged on this course of action, this profession, because they want to, but others really are victims of trafficking or exploitation, and that's no longer consent. So how is prevention important among girls, boys? And we could even broaden that to talk about online pornography, because we all spent more time online during the pandemic. And for example, in Montreal, there's a whole issue related to that. How can we make sure our laws are better aligned to facilitate people being arrested when they need to be? And how can we do more in that respect to help women in that sector?
I'm sorry, is this question for me or for the other witnesses?
En fait, ça pourrait être pour vous.
Well, it could be for you, or others can also jump in.
I've done a lot of talking. Do the other witnesses want to speak, or should I go for it?
I might kick it off if that's okay. So I hope that my connection is okay. Can everyone hear me? Okay, wonderful. I just want to start off by saying that we often talk about sex work and exploitation in the same topic, and it's often assumed that sex work is inherently exploitive, that the very act of selling sexual services is exploitive. First, I want to say that that is a long-term moral debate that is false, and we are being treated to harmful laws as a result of that moral debate. I also want to say that human trafficking is not the only form of exploitation that could take place at work. At your work, you could experience exploitation in being overworked and underpaid. You could experience exploitation in working unsafe conditions. And this is the exploitation that sex workers are facing as a result of their criminalization and being pushed to unsafe spaces. Maggie's Toronto Sex Workers Action Project, we advocate for the decriminalization of sex work. And decriminalization, just to be clear, is the removal of any and all criminal offenses that target sex workers, clients, and third parties. We're not asking for the repeal of trafficking laws, but we're asking for a less problematic application of the laws because there's an assumption of abuse and exploitation in sex work, and there's conflation with human trafficking. And there's an overbroad application of anti-trafficking laws. In particular, they target migrant sex workers. There's aggressive law enforcement, profiling, and surveillance, which pushes sex workers into further isolation, where they're even afraid to access key services like health services. So we will always advocate for decriminalization of sex work. And we would love to see the day where we can talk about sex work like any other respected profession, like agriculture, where trafficking takes place in agriculture, but we can have a conversation about agriculture without a conversation about human trafficking and the choice that individuals are making. I would love to see that conversation take place.
And I'll just jump in quickly if that's okay. So again, we're very clear. We're the Canadian Centre to End Human Trafficking. We're focusing on this issue. And we intentionally don't, look at the broader moral question of, what is inherently exploitative. I think it really detracts us from focusing on where there is gross exploitation taking place right now. And I think we need to be practical about it. So when we look at human trafficking, and again, we're aligned with the Canadian Criminal Code in part because we want to align our statistics with Stats Canada, and also because there are points as well where people choose to ask to be referred to law enforcement, and then it helps in terms of being able to refer that case. So we define human trafficking as the recruitment, transportation, transferring, receiving, holding, concealing, or harboring of a person or exercising control or direction over their movements to exploit them or assist in facilitating their exploitation.
Very good. Really sorry, I'm going to have to move on. We're going to Ms. Matheson for 6 minutes. Thanks.
Thank you, Madam Chair. And again, thank you to all the witnesses. It is really interesting, compelling testimony that we hear today. And I'm really grateful for it, in addition to a clear understanding and a clear explanation of the differences between the choices that women have or the choices that women don't have. So just in terms of that, I would like to hear a bit more about that push on decriminalization and what steps, how that's certainly impacted. You've talked briefly about how that's impacted women, that and I mean those who choose to define themselves as women, how that impacts them, but also sort of a future path. I'm looking sort of for a vision that you see in terms of where the government needs to go, obviously decriminalization being one of them, but maybe some of the supports that the government could put into place that they necessarily haven't seen. I think about what a universal basic income might mean, or certainly what in terms of that decriminalization, larger social supports, what that would do to help industry.
I just wanted to double check if this question was for myself and Julie.
Yes, well, and all witnesses are certainly welcome to add on their thoughts on this for sure.
Go for it. Ms. Stuffy, did you want to answer?
Oh, sorry about that. I think there was just a lag on my end. Thank you for the question. Certainly, decriminalization is the first step, but it's still not sufficient, as it won't prevent all communities of sex workers from being profiled and over policed. But it would be a first step in reducing the stigmatization and the isolation of sex workers. Um, we would also like to see greater funding for community peer-led organizations who are on the ground supporting their communities and who can relate and understand and offer the appropriate referrals and services. These organizations are massively underfunded, even though they are doing incredible work. Um, so I think more recognition from the government of how important this is through funding is really vital. I can't emphasize enough the need for decriminalization. The government has committed to do a review of Bill C-36, and there's yet to even be a committee to review it, and we've been waiting. Um, all the while submitting evidence of how harmful these laws are. So it's a little bit frustrating to like we're continuing to say the same thing over and over again because it hasn't happened yet, and there hasn't been the political will for it, and I think that's very sad. We're here today talking about the impact of COVID on women, and sex workers are afraid to file their taxes. Such a simple thing like any other worker can do. So many sex workers have missed out on the emergency funding because they're afraid to submit their name and their profession to the government. And that's so unacceptable. And decriminalization would be a massive shift to help prevent that from happening.
We'll connect this in the brief that we're sending, but the Canadian Alliance for Sex Work Law Reform does have a comprehensive guide to of next steps for people who do sex work. So it's all there, and like Jenny said, it's something we're constantly, going through and describing over and over. And we do have this promise for the government to review the bill, and there's no committee. So we're doing all this labor consistently with, for nothing.
Thank you, and that additional report to the committee is very, very welcome, of course. So just to highlight back to you had mentioned, Ms. Duffy, you had mentioned the review of C-36, which was actually supposed to happen December 2019. So unfortunately, the government isn't moving as it's supposed to on that. Now, one of the proposals that we had, it's my understanding that the Justice Committee is really quite overwhelmed by a lot of legislation going through. And so one of the suggestions we had was to create a special committee to specifically look at the review of C-36 and to insist that sex workers are participants, ex officio members of that committee. And so I was wondering what you believe, how that would help going forward.
I think that's essential. Sex workers need to be in control of their own lives. They need to have input on laws that affect their work. So yes, just as a basic principle, sex workers should absolutely be involved in that committee. But I also recall in the Bedford case, sex workers were involved then, sex workers were consulted then, sex workers submitted reports then, and we still ended up with these bad laws. It's not enough to have sex workers at the table and to be able to check a box and say that we consulted sex workers. We need to be listened to. And it's not even just sex workers saying this. It's legal, social work professionals who are saying this as well and who have evidence as well that these laws need to be repealed.
Very good. All right, we're going into our second round. We're going to start with Ms. Sahota and Ms. Shin that are splitting their time. Go ahead, Ms. Sahota.
So my question is for Julia. Julia, you're familiar with the 2014 report of the National Task Force on Sex Trafficking of Women and Girls in Canada?
I am, yes.
Okay. The task force urged governments to invest in jobs, training, affordable housing, counseling, and other supports. Are there any specific ideas that the center has for how the government could help prostituted women and girls exit or escape sex trafficking through these type of initiatives?
Absolutely. I think part of it is that there's general trends, but there's no one set of programs or response or services that's going to support trafficking survivors in that space. It's really dependent on their experiences and also the level of trauma and the length of their trafficking experience. So in moving forward, when we look at job readiness, but also retraining programs, models that include comprehensive wraparound support systems that include everything from basic needs and shelter to counseling, case management, and referral, generally show better outcomes for those individuals as they start transitioning out of sex work or out of their trafficking experience. I will say that those programs and services focused on individuals that are independent and consensual sex workers isn't our wheelhouse. Again, we work specifically with individuals that have been coerced and forced and exploited into sex trafficking. And again, their needs and services are very different. The trauma is quite intense often. And so really there needs to be a full suite of wraparound supports to, again, continuously meet with them along that journey. Just because someone has experienced a lot of trauma also doesn't mean their lives are over. It just means that we need to be focusing on equipping them with other tools to be able to survive through their trauma.
And over to Ms. Shin.
Earlier this summer, Megan Walker from the London Abused Women Centre testified that trafficking and sexual exploitation did not suddenly disappear or slow down during COVID. It increased. And men who believe, now this is very disturbing, they have a right to pay to rape women and girls, increase their demand for underage and young women and girls. We also know that with this appalling kind of insight, that despite growing awareness, we are still seeing insignificant sentences in human trafficking convictions, with judges deferring to the minimum rather than meaningful penalties that convey the seriousness of this offense. And as you know, we formerly in Parliament, we've been reading Bill C3. Do you feel that something like that, like Bill C3, could also be applied to human trafficking to increase that sentence? What are your thoughts on the kinds of criminal code legislation that could help send the message that this is wrong?
Absolutely. And thank you very much for the question. Again, looking at our own data, we have nothing to suggest there's been a huge or significant increase in human trafficking. I don't want to say that Ms. Walker is incorrect. She's speaking to her own case load and people that she is serving through her organization. But from a national snapshot perspective, we just can't reasonably make that claim. In terms of the prosecution rates for traffickers, I think one of the issues is that our legal system is not designed to effectively support any victims of sexual-based violence. Right now, the way that our criminal code and legal system is set up is that it's very dependent on victim testimony. And traditionally, there's also been a lack of training for judges, and so then there's a lot of victim blaming that takes place. There's usually very strong cross-examination, which really often includes gaslighting and making victims question their own reality and their role in terms of their own exploitation. And for very straightforward reasons, knowing that, a lot of people don't choose to go through that system. It can be incredibly.
I'm really sorry. We're going to move to Madame LaRouche.
Thank you to all three of you. All very interesting. I'd like to come back to today's topic. We really want to focus on the impact of COVID, especially on women. And we're at the Committee of the Status of Women. I'd like to come back to that. Do you think that there are different government support measures that were adapted to the reality of sex workers? I'd like to come back to that. If you could summarize in regards to lodging and other things, it wasn't well prepared to help them to get out of this situation.
Madame Bowman.
I guess I can take that.
Aussi, si vous voulez, ça peut s'adresser.
If you wish, of course.
Elaboration on what she means to get out of which.
En fait, j'aimerais savoir justement son résume.
For you, I'd like to know in what the government has done. Are there any ways where the government didn't adapt the situation well for sex workers? I'd like us to come back to things that weren't well adapted to sex workers. For example, it could also be for Ms. Duffy, the different government measures. We've talked about it. We've talked about filing their taxes, for example. Sex workers weren't able to make the most of CERB, for example. So we've realized that measures that have been put forward by the government were not adapted to sex workers. And you can all answer what kinds of measures were not well adapted. For direct intervention, for example, lodging, links with hotels and help programs. I'd like to hear you if you'd like to speak to that.
Well, it's a very big question because it's hard to think of anything that was well adapted to sex workers' needs. Right away, what comes to mind in Ontario is the closure of strip clubs with hours of notice. This was not based on any empirical data, no real evidence that there was an increase of COVID within strip clubs. Well, there was evidence that there was increase in other types of commercial businesses like restaurants that were, literally a few doors down from some of the clubs. This overnight, I think because of the stigma, people who work at strip clubs were just maybe an easy target for the government to feel like they were doing something, while causing, the overnight loss of employment for many, many, many workers.
Very good. I'm sorry. I skipped over Ms. Zahid, and so we'll go to you for 5 minutes.
Thank you, Chair, and thanks to all the witnesses for your very important testimonies. My first question, and I will be splitting the time with my colleague, Ms. Hutchings. My first question is for Ms. Stridek. I saw on your organization's website a number of issues have been raised in regards to how Canada's immigration programs, such as the temporary visa programs, can be exploited by human traffickers, and people in these programs can be vulnerable to exploitation. Have these vulnerabilities increased due to COVID-19, and do you have specific suggestions we could recommend to the government to better protect women and other workers?
Thank you very much for this question. I think that labor trafficking is an incredibly important issue in Canada and really deserves more attention. When COVID first began, we saw that there was a real trend in terms of transmission in our agricultural sector, specifically among temporary foreign workers. This, for very good reason, rang a bunch of alarm bells and brought attention to the issue, but I have to say it's incredibly long-standing. Prevalence of labor exploitation along the continuum and insofar as human trafficking is, quite rampant across our agricultural sectors. And in terms of responding to that, I actually think labor trafficking is a little bit more straightforward in that we actually have labor laws and rules that have been established to protect the rights of these workers. They're just not being implemented properly, and it's not being regulated by the appropriate level. So I do believe that this is done through the provincial governments, but I think actually enforcing the laws that we have would go a really long way in addressing this. Labor traffickers are clearly breaking the law, and it's much more black and white to be able to determine where a crime of trafficking is actually taking place.
Thank you. I will share my time with Ms. Hutchings.
You're on mute, Ms. Hutchings.
That always helps. Thank you, Madam Chair, and thank you to all the witnesses here today. This topic is certainly important to all of us, and hearing your testimony really makes us work even harder. But I also want to thank you for your advocacy. Your advocacy has truly made a difference because year over year we have increased our investments and we've provided stable long-term funding for organizations such as yours to empower women. and create change across communities. Between 2015 and 2019, our government's increased the funding to women's and gender-seeking organizations from under $20 million a year to over $65 million per year. That's giving long-term funding to over 500 organizations. And this year, we're going to approve funding of $110 million, and that is in addition to the $90 million given by Wage to help organizations due to COVID-19, and another $10 million from Indigenous Services Canada. That's helping 1,000 organizations. So it's your advocacy that is truly making a difference for this. My question for today is for Ms. Duffy. Based on your experience, do you find that the LGBTQ community has faced additional risks and barriers in sex work, especially during COVID-19? And how can we all work hard to address that, if so? Thank you.
Thank you so much for the question. So I will first say that the discrimination that the LGBTQ community faces in accessing what we would call mainstream non-criminalized work often makes sex work the best option. It's a low barrier entry, and we have a lot of anecdotal reports from workers saying that they experience a sense of community through doing sex work that they don't experience um, doing mainstream work. Um, However, there are ways that this community is targeted and continues to be over surveillanced by the police force. And so for this reason, they are at risk for being sex workers, and at risk, especially if a person is transgender. They are targeted over police. Um, they are subject to violence, and there's a really interesting report. Maybe we can send the committee about the violence that the police commits to sex workers. Yeah, I think that's all for now.
Okay, thank
Very
you.
good. That's your time. Sorry, Verity.
sorry.
I'm going to go to Ms. Matheson now. 2.5 minutes.
Thank you. I wanted to get quickly back to one of the calls that I know that there's a larger network across Canada for sex workers, advocacy for that. And out of SWAP Hamilton, I received a letter. They were urgently asking the government to allocate funds to organizations working directly with sex workers, but to have far more flexible funding and granting mechanisms to allow for that, considering we don't yet have that decriminalization part. So I wanted to ask a bit about that. What though, and if that actually if you've received that from the government, those low barrier mechanisms that you were talking about before.
Sorry, I'm not sure if I'm completely clear about the question.
So one of the asks was from the federal government to have more of those flexible funding, granting type mechanisms, right? To ensure that funding for organizations that provide support to sex workers, because they're so often left out of any sort of traditional idea of grants or funding, that there be a consideration of that, especially during COVID, but that they were talking about providing even things like prepaid debit cards and those low barrier funding models. So I was wondering if you had actually received any support from the federal government for that after your ask, and I think that was, months ago. So if you received any word on that.
So no, we have not received any funding from the federal government at all. The majority of our funding, especially for all of our operational expenses, even some of our staff who have very limited hours that we were able to secure, has come from community donations, very small fundraisers, people who send $5 from an e-transfer to a PayPal to drop something off. All of our donations, literally 95% of our funding comes from community donors. The biggest grant we've gotten is from a global organization called the Red Umbrella Fund, which is a low barrier grant for sex worker organizations. And then we have received some small other grants from Red Cross and so on that were very high barrier that we spent a lot of time to apply for, and it is a struggle. And there's been even more than all of that we haven't been successful in getting.
All right, now we're going to go to Ms. Sahota.
Okay, so I'll go back to Julia. Julia, the task force that we talked about was clear with their recommendations for marginalized women and girls. The task force, and I'm taking a quote from there, believes that marginalized women are best served when selling sex is decriminalized while sex buyers are held accountable. However, our support for this model is conditional upon a significant public investment in gender equity. Unless Canadians support the intention behind the law, illegal acts could simply be driven underground. Our government, supported by civil society organizations, must commit to gender equity education at every level and to Canada-wide public awareness initiatives. You spoke earlier about the education material that's out there from your organization. Does the Centre have a strategy for educating men and boys on the harm of buying sex and the importance of gender equity, and what does that look like in your educational material?
That is currently not something that we're prioritizing in terms of our general education material. When looking at other jurisdictions that have attempted to either completely criminalize or decriminalize sex work, the jury is not out in terms of what models work. In some areas, it's created additional safety for some sex workers, whereas others are pushed further underground. Amsterdam is a good example of this, where we're finding that in the regulated areas, there were enhanced rights for sex workers, but then outside of those regulated areas, we saw that there was an increase in exploitation and in trafficking. And so this is not something that the Centre is looking to tackle head on or by itself. We're really focusing more specifically on where human trafficking is taking place. But I do agree that we need to make sure that human rights is at the very center of whatever approach that we take. You cannot just flip the switch and decriminalize and expect that it's going to result in positive outcomes for everyone. Because fundamentally, the reason that trafficking exists in Canada is because it generates high profit for people that are comfortable fundamentally exploiting, manipulating, and controlling other people. And so we need to be dressing at both those layers. Yeah.
Am I able to add something quickly? I just wanted to say that if you want to support and be inclusive of people who do sex work, you have to stop going to prohibitionist organizations who deny the existence of consensual sex work and conflate both sex work and trafficking. So I've heard two quotes from someone who is a prohibitionist, and it eliminates the agency over people who do sex work and choose this work. So I just wanted to add that because it's so frustrating to hear something that is directly exclusive of us and our organizations.
Thank you. I'm just going to ask another question if I have time to do that. Julia, you said we talked about the task force and putting the needs of the most marginalized first. Based on the Centre's research and data, what are the key steps Canada should take today to put the needs of the marginalized first during the COVID-19 pandemic?
So in research we recently conducted, there's no one demographic profile of someone who is more at risk of being trafficked. Really, it comes down to social isolation and usually emotional vulnerability. And that's what traffickers look at to exploit when they're trying to recruit, groom, and then exploit someone within the sex market. Sorry, can you repeat the question? Oh,
you're on
you're
mute.
on mute.
Based on the Centre's research and data, what are the key steps Canada should take today to put the needs of the marginalized first during the COVID-19 pandemic?
So sexual trafficking is a form of intimate partner violence often. It can happen through other players as well, but we need to be starting early and integrating awareness in terms of what healthy relationships look at and really focusing on addressing holistically reducing sexual exploitation in Canada. In addition, part of it is that there needs to be better cooperation amongst different law enforcement jurisdictions in pursuing different cases. Traffickers are able to move across the country quite quickly because they're able to avoid law enforcement detection. But also law enforcement need to be comprehensively trained in doing trauma-informed work and making sure that they are also understanding the difference between consensual sex work and those that might be being trafficked.
Very good. And final round, 5 minutes to Ms. Hutchings.
And I'm going to give my time to Mr. Serret, Madam Chair.
Monsieur Serret?
Thank you. I wasn't sure if I would have the time. So thank you, the witnesses, for your testimony. I just want to go back to one of the earlier questions that was asked about the role that you would see the government play at all levels, especially the federal government. First off, on the role of men and boys and the education side. Previous committees for that we've studied here, we studied the role, and it's always been controversial because we need to get more monies to women organizations. We know this, but there seems to be a disconnect with the current organizations and the lack of funding to ensure that more education is provided, especially at a younger age, to men and boys. So I just wanted to get a sense of. I know you said earlier that you weren't in that space or you weren't focused on that, but and I appreciate that. But if you would have some specific recommendations to us as a committee back to the federal government, what would they be?
And
I think there's a real. Oh, sorry.
I just see Ms. Bauman's hand up as well. Is that for this question? No. Okay, go ahead, Ms. Stride.
It is up from a previous question, but if there's time, I would love to touch on this as well.
Okay, we'll start with Ms. Stride. I can go then to you.
I think there's a need for real national standards in terms of having a really strong gender-based analysis of the type of things that we're doing across curriculums. As we know, this is largely led or completely led by the provincial government and under their jurisdictions. And unfortunately in Canada, or sorry, in Ontario, we saw an issue where the issue had become so depoliticized that things are changing and we're not necessarily aligning with comprehensive best practices and evidence-informed teaching models that can really get to the heart of what we know in terms of addressing gender-based violence at the early stages. So again, I'm not sure how you would deal with those jurisdictions, but unfortunately the issue of sexual education, consent, what it means to have healthy relationships has been overly politicized, and really we need to depoliticize it and make sure that every youth is equipped with the tools to be able to identify unhealthy and exploitative relationships, and they're equipped with what to do in that case.
Ms. Bauman.
I was just going to say that this is a little saying, you know, to educate boys and young men to not pay for sex or da-da-da. It's just oversimplifying what we need to do, or maybe the opposite of that. We need to make sure that youth understand consent, like Julia had said, and understand that, yes, you're going to want different things and meet people who want different things. And in those moments, you need to be able to express and understand consent. If it is watching porn, you know, ethical. If it is participating in purchasing sexual services, make sure it's consensual, ethical. This needs to be more, again, inclusive of people who do sex work. Otherwise, it's just gonna, like Julia said, this is more about politicizing things instead of actually providing education that evidence is shown is needed.
Thank you, and I'm from Northern Ontario, and human trafficking sometimes in conversations are just dealt with in larger cities, but I know this is an issue in rural Canada and smaller communities that have possibly less support and services. So I just wanted to see if you other witnesses here would have specific recommendations to the federal government on how can we best deliver services in rural areas.
Thank you very much for the question. And I know that human trafficking is one element of where service provision in rural and remote communities can be so different from what we see in urban areas. So I think this is such an important question. We are absolutely seeing human trafficking in Northern Ontario. One of the things that we do see too is especially like along highways 11, 17, there aren't as much people. So it's actually easier for traffickers to be able to move through those areas without being detected. And we also have this perennial issue in terms of where do you place services so that they're accessible to everyone, given some of the vast geographic areas. I think Northern communities have shown some, great progress around service collaboration and coordination, which really goes to the heart of this. And I think a lot of our rural communities are really showing best practice in that, even compared to major urban centers. But we also need to be innovative and focus on how we can use digital tools to ensure that those services are accessible to everyone. Lots of human trafficking survivors have had issues in accessing virtual tools. It's not easy for everyone, but I think we need to think about how we can adapt the way that we're working to be able to reach people when they're not necessarily a 12-minute walk from them.
Very good. That's the end of our time, unfortunately. This has been a great panel, and I want to thank the witnesses for your testimony and to all of the committee members for your excellent work today. With that, I'll see you at the next meeting. Meeting is adjourned.